Friends, it is a real pleasure to be here this evening to see the first official turning of the earth here that will start the building of this hospital.
As this building grows into reality, bless every leader, every director, and every worker that this hospital in all its future shall be a place where new life and healing shall be administered equally to all without regard to race, color, or creed.
The Lodi Memorial Hospital story is truly the Lodi story. It's a story of vision, growth, determination, success, and a true sense of caring about your neighbor. In the waning days of World War II, the nation was still propelled by a strong war effort, and there was a bittersweet enthusiasm as people looked to life after the war. So much and so many were lost, yet the future was full of promise. In Lodi, farmers, teachers, housewives, bankers, and others rallied to undertake a project that would demonstrate their hopes for the future, yet honor those they loved who were lost in the war. They contemplated the construction of a veterans building, but the more they explored that project, the more their enthusiasm took them elsewhere. A hospital, yes, that's what this community really needed. Those farmers, teachers, housewives, and bankers had no experience building a hospital, yet they formed the nonprofit Lodi Memorial Hospital Association with the single purpose of raising funds to build a quality medical facility for their neighbors. And they would name their hospital Lodi Memorial in remembrance of those who gave their lives in freedom's name.
Dad was dedicated to this whole idea of the hospital, and of course, Mother was his helper. And they were not shy at all about knocking on doors. They felt that the people of the community really wanted this. They wanted the community to be able to own it, and so the community had to pay for it.
Marshaling their troops, association members campaigned among their neighbors. They knocked on doors seeking donations, and amazingly, from 1945 to 1950, they collected $800,000.
I was so impressed by the vision these people had. I knew them personally. And they were meeting in a shack here in the hospital grounds, and you wondered what would come out of this.
How in the world did a few local individuals think they could ever pull off raising $800,000 and building a hospital in post-World War II Northern California?
The thing I remember mostly is that I canvassed the east side as best as I could, ringing doorbells and asking people for donations of $10, which made them a lifetime member of the Hospital Association.
They started building before they had all the money. And there were, I think, 10 people that finally said, look, we'll guarantee the rest of the bonds. They were selling bonds. And these 10 people guaranteed the bonds so that the building kept going, and they finally made it.
Hospital Association members were determined to bring the best hospital they could to Lodi, and that's what they did. The doors opened March 30th, 1952, and have remained open ever since. The Lodi Memorial Hospital story illustrates the can-do spirit of this community. It's this spirit that gave birth to this hospital and sustains it to this day. It's the people, doctors, nurses, volunteers, and support staff who carry out that spirit and vision in a meaningful way.
I think there was a considerable degree of respect among all of the physicians relative to their colleagues.
As Lodi grew, so did its need for hospital beds and medical technologies. By the late 60s, the hospital was so consistently overcrowded that patients were being cared for on gurneys in the hospital hallways. The community rallied once again to meet this new set of challenges. Federal funding and a large bank loan enabled the move forward with more beds for patients. But soon, residents outgrew existing emergency services, and the elderly were living longer with a whole new set of healthcare needs.
The hospital, when I came, was in very difficult financial straits. This west wing was under construction, and the financial officer a few weeks later said that we didn't have money in the bank to meet the payroll. They'd forgotten to tell me as a new administrator that that had been foreseen, and we went to work, and the bank provided a loan for $250,000 so we could meet the payroll.
Should we join with another hospital?
We're self-supporting here in Lodi, and would it be advantageous for us to join with another hospital? We probably would be mustered into a group, and there were some people that thought we ought to do that, and we've taken the long road to do it ourselves, and with a fair amount of success.
Through its growing pains, one thing remained constant at Lodi Memorial Hospital, and that was the quality of care provided by the hospital's nurses, physicians, volunteers, and support staff.
I think we have an excellent staff, and I think we can tell that by the way the nurses just stay here. We have a lot of nurses that have been here for a long period of time.
When I came here, I was absolutely impressed with the equipment, the staff, and so forth. And I felt in many ways there was an improvement over what I'd experienced at the university hospital level.
I had my first two sons at other hospitals, and my third son was born here at Lodi Memorial. And just by comparison, my most positive experience was here at Lodi Memorial.
People feel that they get extremely personal, caring, compassionate care in this hospital, and the nursing staff takes a lot of pride in what they do.
The way that a hospital can respond to what's going on is much better with this type of setting than with a large hospital chain setting. And so maintaining our independence, I feel, is very important, and I think that for our community in the long run, if we can continue to do so, this would be so much better.
Lodi Memorial Hospital recognizes that having a healthy community means more than access to clinical care. It is access to all of the elements needed to keep you healthy. That's why, in addition to medical care, Lodi Memorial operates or supports a network of clinics, an adult daycare center, a child care center, a residence for battered women, parish nurse programs, and much more.
You do the needs assessment and listen to what the community wants. I think that's really what makes this hospital probably the best, is because it really listens to its clients or its patients.
44% of people who came through the emergency room had no local primary care physician. And we use that as a benchmark in trying to reduce that and give people access to primary care through our local clinics. And after expanding to Galt and to Ione and expanding here in Lodi as well, we're fairly proud of the fact that we've been able to reduce that number from the 44% down to around 15% in 2001.
I'm ever amazed at how much outreach there is from this hospital. You don't have to be a patient here to receive services of all sorts, to receive educational material, seminars. They are really very conscious of the need to promote wonderful health in the community.
For 50 years, Lodi Memorial Hospital has strived to meet the needs of its community within the realm of its resources. It has done so in a creative way and has been at the forefront of the state's hospitals in responding to its residents' needs. The next 50 years promises a new set of challenges that will be complex and expensive to address. Unfunded state mandates, especially in the areas of nurse-to-patient ratios and seismic retrofitting of the hospital facility, will be costly and difficult. No doubt the hospital and the doctors, nurses, volunteers, and supporters will rise again to the occasion.
I think a lot of that original visionary spirit is still here today, and particularly in the board members and the medical staff, as well as among the staff that works at the hospital.
I think I was very fortunate to have had the opportunity to spend as many years here as I did.
That's what people want most. Good service, good quality service, and if we're able to do that, we'll be around for a long time.
For businessmen and Woodbridge brothers-in-law Gabriel Pineda and Robert Lucero, whose 6 children between them were all born at Lodi Memorial Hospital. For the many talented retirees in our community. For the babies born here today who will lead us tomorrow. And for those who are proudly associated with Lodi Memorial Hospital by their volunteer work, by their profession, or by their financial contribution, Lodi Memorial Hospital promises to hold its founder's vision close to heart. A nonprofit hospital operated by those who live in this community for those who live in this community. A hospital that treats its patients, visitors, and employees as if they were family. a hospital community members know and rely on for personal, quality care.